of the competency with me first. So I'll ask them what are the 5 indications for oxygen therapy. I don't know if you have them prepared yet, but
I got it. It's going to be documented signs of hypoxemia, which is going to be a PaO2 of less than 60 and an SaO2 of less than 90. Less than 90. Less than 90.
Okay.
Yeah.
Good.
Next is going to be any acute situation where hypoxemia is suspected. Then it's going to be severe trauma. It's going to be acute myocardial infarction. And it's going to be for short-term therapy and surgical interventions like patients who are just getting out of post-anesthesia.
Very good, Gabe. Can you tell me what are the 6 hazards or precautions?
6 hazards is going to be if we have a PaO2 of greater than 60, then you could potentially get ventilatory depression if we have an abnormally high PaCO2.
Good.
If we have an FiO2 of 0.5 or greater, then we could potentially give absorption atelectasis, oxygen toxicity,
Good.
and we can also cause depression of cilia and leukocytes. Next, we want to be mindful of patients who have been poisoned by quark poisoning, like bug spray, and bleomycin, which is a kind of medication for cancer treatment.
It is.
And next, so we want to take care to understand that oxygen is a combustion.
Yes.
So the more oxygen we have, the more there is a fire hazard.
Good.
And in that, we need to be mindful of potential procedures that can cause that combustion, like laser bronchoscopy.
Good.
And the last one is going to be, we need to be mindful of potential bacterial contaminations with humidification and nebulization.
Wow, wow, wow. What are the contraindications?
No contraindications.
Very good. All right, Gabe, we're going to do some identification of equipment here.
Sure.
I know.
This is the air entrainment device or Venturi mask.
Very good. Is it low flow or is it high flow?
It is a high flow.
How much FiO2 can this thing
The
give?
FiO2 can give 24 to 50. I can get 60 in that case.
Very good. What's this thing here?
That is going to be a partial rebreather by the look of it. There's no one-way valves.
Try again.
This would be a simple mask then.
It is a simple mask.
Yeah, we're
A
using
simple mask. Is it low flow or is it high flow?
It is low flow.
Very good. What's this thing here?
That is going to be a oxy mask.
Very good. Is it low flow or high flow?
Low flow.
This thing here, what's this one?
Oh, it's kind of got a lot going on there.
What is this one?
That is the Oxymizer reservoir nasal cannula.
Low flow or high flow?
Low flow.
Good. This guy here, what's this?
That's a normal nasal cannula.
Low flow or high flow?
Low flow.
What is the flow range for a nasal
The
cannula?
flow in regards to liters is going to be 1/4 to 6.
Very good. What's this thing here?
That is a non-rebreather.
Okay, and is it, I'm sorry, is it low flow or high flow?
It's low flow.
Very good. And how much FiO2 does it give?
FiO2 for that one is going to be 60 to 80.
And then what's this thing here?
That's the partial rebreather.
Very good. Low flow or high flow?
Low flow.
Very good. On the middle rack, what's that thing there?
That is going to be the air entrainment nebulizer or the cool mist nebulizer.
Low flow or high flow?
High flow.
Very good. And what's that behind you?
Oh, coat rack.
It
is the high flow nasal cannula.
Very good. Is it low flow or high flow?
High flow.
Nicely done. So that's how the first portion is gonna go. Gabe, honestly, if I get you tomorrow, I'll just say 100 out of 100 because you did that exactly how you were supposed to. Simple math, maybe, but for the sake of being the guinea pig, I'll catch you against that. So, little catch there.
The other simple
What's tricky
masks,
about it?
the other simple masks have a different shape, a different colored band, and like a general different like everything. This is so similar to like
I put out bowls, so I put
know.
a tricky size. Okay, so he picks out a random scenario, and that's on the board what he picked. Homer Simpson, date of birth 5/12/65, MRN 66762 is in the PACU of SJVC Hospital, status post gastric bypass surgery. SpO2 noted to be 83%. MD has requested your recommendation for O2. What oxygen delivery device do you recommend? So at this point, I'll have a seat at my table, and Gabe will have been sitting as well, maybe kind of reviewing this